Good afternoon, everybody. This is the last day of March, and I wanted to do a 30-minute or so catch up on COVID because a lot of things have changed in your responsibility in the last 2 weeks. We did not invite a live audience today. We will be putting this on our social media websites and then sending out a MailChimp to everybody that is part of the ALR circle. So hopefully you'll get to see this in the next few days and you can get caught up. So we're going to specifically work on COVID. All right, so we got a new directive this week, the RCF Bible, as I call it, and it is out. And then the issue is, though most of the country would love this stuff to be gone permanently, it is not. We have a couple of new variants in Colorado. One is an Omicron cousin, and one is an Omicron Delta marriage. They're both staying fairly low key, but they're showing up across the state. So it's hard to tell how long or how well we're going to do with this. We've had over 1.35 million cases with 12,000 deaths in Colorado. So please understand, as far as the government and the health department and the upper echelon, this is still a very serious situation. We were down to about 9% intensive care beds being used for COVID only. But, again, that could change in a moment's notice. And we are seeing more actually people in ICU beds that COVID is not the primary diagnosis, but the second or third diagnosis. About 50% of our counties are showing the new outbreaks in the new 2 variants. And so again, it's got my attention. We're watching, not going to quit living our lives, but we're going to have to watch carefully to see how this goes. So nice change. We don't have to do EMR resource every week anymore. So choose a date, figure out a day of the week that works best for you. And then, so let's say you are willing to do Thursdays, then you want to do the Thursday that's between the 1st and the 15th, and that same Thursday that's part of the 16th to the 30th. They would like you to do both COFI and EMR on that same day. And they have, are lightening up, so we won't have to do it as much. And so the simple reports, though, on the other hand, when you do rapid testing, for all the 100 reasons you may have to do rapid testing, those are still due on simple reports on the day of the test. All right, so some cool things that happened in EM resource. We got rid of a bunch of junk. So all you got to do is worry about if you have availabilities to let the state know, because they're still going to have to figure out an emergency system if we have a major outbreak. And then they want to know current vaccinated is exactly the same as up to date. And I'm just going to leave current fully vaccinated in my head because it's been there for such a long time. But you're going to notice the new language is up to date residents. And then the up to date staff is the same thing. They've had both of their primary doses, and so it would be the first dose, the second, and then their booster, and then that makes them what we consider up-to-date staff or fully vaccinated staff. So they've cut down the amount of noise they need in the EM resource. They moved all the flu stuff over to COFI, and so EM resource shouldn't take you very long at all anymore. So remember, we have a 5-section notebook. I've had state at different facilities, and people that got all this done got beautiful surveys, got beautiful feedback. They couldn't find a single thing to fuss at, and they left. People that are not done, they're doing full surveys on. So a 20-minute infection control survey is turning into 2 and 3 days, and then they're tagging everything they can. So on the new RCF, you need to replace this in section 5. If it's a desktop version, or you do both like I do, remember that Control F is your friend. And you can, you need to go to page 54 and pull that out of the RCF and put it where you can get to it really quick, because it talks about outbreak and when you have to do PCR testing and all of those good things. So it's easier to follow than all the language. And then put also that map into section 4 of your book. Okay, so here's the jump to this, and you can go get your new copy. A new thing that came out in the last couple of months, and very few of us have gotten it done, is to take the training validation for infection control. They've asked that 2 people in each facility minimally are trained to this. So if you go to page 12 of the RCF, then you will be able to get the information you need and sign up for co-train and take the training. I'm going to try to get it done next week as well, so I'm right up to date with you. But the big thing is that they're trying to help people get the right information, understand the rules, and that community rules. It doesn't matter what the community's doing. You are not under community rules. You are under federal rules, because our whole state is under the federal arm of CMS. And because of the survey process coming out of that federal arm, we are at the same regulations as hospitals, nursing homes, adult day, those types of things. So you do not get to stop doing the right thing for the right reasons. You're going to have to stay on target. All right, let's look at some education that needs to be done with your staff. And I'd like you to have them go through. There's a new training on Project First Line on cleaning, environmental training, and then competencies. So 2 things. As the administrator, remember that any products you use in your house, you have to have an EPA number. I've given you the jump of where to go find that if you don't have it on your bottle. If you're buying like gallons of stuff and then filling other containers, please buy you a label maker, and you put the name of the product and then EPA number on it, and that will show that you're doing due diligence. You cannot use any hand soap that does not have disinfectant in it, so you can't go back to the nice hand soap and the white creamy stuff. Make sure that you're using the right products so that you don't get yourself in trouble. Okay. And then, so in Project First Line, the training, I went through it the other day. And so they talk about how to handle a resident space that's sick, flu, norovirus, C. diff, COVID, whatever is plaguing them. And then they talk about also the responsibility of cleaning a room or an apartment if the resident moves out, and the additional things you need to do if that resident had any illness of any sort and they had to go to the hospital and then they couldn't return, or you clean before they return. So the program is pretty decent, and there's some good techniques on, or not techniques, there's good topics on there talking about things. And then please make sure that you have a competency figured out and that you collect this in your training area. All right, so Census and Staff Roster, please keep it current. And I recommend you place it in 3 spots. So it goes in part 1 of your COVID notebook. Remember, our COVID notebooks are one part of our emergency preparedness planning. It goes in the Mars, and I would get a clear plastic sleeve and put them in there so that when any surveyors show up at the door, the staff knows immediately to go to the Mars book, pull out the sleeve, hand it to the department. That has changed attitudes all over the place when this happens. And when it doesn't happen, then the surveyors change a whole trajectory and become pretty darn cranky. And then I would recommend you also keep a cloud-based one or one in your office where you can update it when you need to. And you do need to update it if you get a move in, move out, new staff. So at least once a month, minimally, and you may need to do more, it depends on how much change you're having in your community. If you use a cloud version, make sure it's HIPAA protected, and not all cloud-based communities are HIPAA protected. All right, let's talk about some of the elephants in the room. So people are sick of masks, period, and get really sick of the N95s, and they're miserable. And I will, I've been fighting to go back to the blue mask and not getting anywhere. So the feds have really got their thumb down on this, and make sure you are getting the N95s that are US made and NOSH, and not the ones from China that are K95s, those are not, those have actually stuff in them that are cancerous. And so the feds have been very loud about making sure you're getting the N95 with the NOSH marking on it. I would keep a fresh mask at your check-in site. Make sure that visitors, when they come in, take off their cloth mask and then put on a blue mask. You might also want to keep some baby wipes right there so they can wipe their face. Because again, we got to the cloth masks that people keep in their cars and purses and all that are totally contaminated. So we want to keep your house clean, and those blue masks have gone down in price significantly. So you should be able to afford this. And then we are in low to moderate across the state. So again, we've got some new language. And so they've changed it from low to moderate and then moderate to high. And on the COVID website, it tells you in your county, it's both in a table format and a map format of what area you're on. And I would say the majority of the state is low to moderate. Denver and the Front Range, I don't think we're going to get out of moderate forever in a day. It'll take a very long time. And that's, part of your up-to-date information. So we've asked staff, and we're asking anytime any of our residents go out to continue to wear a mask. Hand washing, super important. Please do not go back to your towels. Make sure paper towels are in your bathrooms. Make sure there is enough paper towels. And I know that they're a little bit lean on the market because I went looking for some a couple weekends ago. It took me 2 stores. So you might want to get some ahead if you see them at Sam's or Costco or Walmart, so that you have enough. And then make sure that that there's trainings for the staff on hand washing. There is a plethora of them. And you want to do trainings at least once a month, and you want to put up different posters to remind staff and residents to wash well and how to do that. So it's a reinforcement training, and we're just going to have to continue on this because people do take shortcuts in a hot minute. All right, vaccination plans. I've been helping residents write the new 2022 vaccination plan. We had enough change that the ones we did a year ago are good. They're a nice base, but we can do better for 2022. So you can keep it on your desktop. It is a fillable tool, and then you can just save it. And when you go over on the right, it says saved with the stuff typed in it and then saved without. And so I have one of each on my desktop, and that way you won't lose your work. And again, put it in your COVID notebook under part 3, where your internal policies are, and then along with your map, so that you're kind of really up to date and you've got it all figured out and who you're doing business with. Since we're down to low to moderate, the weekly testing with Mako or whatever lab you're working with is still required for everybody that's not fully vaccinated. And if we move to high, if one of these 2 variants gets a leg and starts really multiplying, we'll be back to twice a week again. If any staff is sick, they have to do a rapid test and do a PCR test at the same time. And that's in the new RCF regulations. The other thing that I found really valuable is to be hooked up with your county and changes to COVID status and email. I've been getting from several counties that I'm following. And so they are mirroring, they come usually within an hour or so right after the state puts out their noise. All right, so please celebrate if your staff are fully vaccinated and your residents, your home is getting closer to being normal. If you are not hooked up with CLIA, it is talked about in multiple places how to get signed up. We're struggling. The girl that was helping us no longer works for the department. I'm still trying to figure out who took her place to get them done in a timely manner. CLIA is your database tool for all vaccines. So if your person has had hepatitis B, hepatitis C, any other vaccines, flu vaccines, measles, any of that stuff goes in there, then you've got the best and the newest data on them. And so and then same thing with staff, you're current, it is accurate, makes sense, and nobody can argue with you. So can't iterate enough that we're still seeing fake vaccination cards out in the community. And twice that I'm aware of, unfortunately, nurses sold fake vaccination cards. So you're just going to have to be diligent and be very careful. Now, I do want to alert you that booster 4 is coming, and it'll be about 5 months post the last booster shot that your resident or staff got. I am not convinced that everybody needs it. On the federal level, they're talking only about certain populations of people, and one of them is age-driven, that they're 65 and older. The other is immunocompromised or chronic disease-driven, and that they have a higher risk of death if they get COVID than not. And so it's not whether you got sick from COVID, they don't really care. Got sick from the vaccination, they don't really care about that. What they're caring about is whether you meet these new criteria. So again, going to have to be pretty careful and diligent and watch to see what the noise goes. Okay. In the federal language, all healthcare facilities must be 100% vaccinated for all staff. If you are accepting waivers, I've worked with a couple of facilities when we looked at federal noise, state noise, and legal noise about civil rights and religious waivers. And so if you're doing that and you have more than one person in your organization on a waiver, I'm going to highly recommend that you look at your policies, you look at all this noise that's out there and revise them about whether you're going to accept it or not. So the insurance companies are looking at this new round of investigations that the state's doing, and whether they're, and one insurance company told us the other day they may not stay in Colorado and do business anymore because we have too high a percentage of facilities not fully vaccinated. I'm really concerned if we lose our liability insurance, what's going to happen next. Visitors can refuse to show a vaccination card. They just don't get to visit inside your house. So there's several rules, and there's wonderful signs that are already made by the department that all you got to do is print and post about wearing a mask, and visitors must check in and they must have proof of vaccination to be indoors to visit their loved ones freely in the house. They can have palliative visits, they can have a controlled visit. And so remember, one of your responsibilities is if you have visitors, then you have to do this major cleaning afterwards. And do you have the bandwidth to do that? I'm going to say probably not. So you're going to have to be super smart about how you do this visitation thing. Volunteers are now allowed to come back. They do have to remain masked and stay in a common area. So there was a lot of questions the other day. Can somebody play guitar? Can somebody play piano? Yes. Can they sing with their mask off? No. Can they eat with residents? No. So they have to stay social distance, and they can come in and do volunteer stuff. One exception is end of life, when you have a hospice situation going on and you need a sitter for end of life, but they also they're in the room and they can leave only to go to the bathroom. They do have to, do standard hand washing. They do have to wear a blue mask, and I would add gloves and a gown to keep them protected. Please have them sign a release and an attestation that they understand the rules and that they're not wandering around your facility wanting to visit and check out to see what the staff's doing. And we've had some pretty interesting stories on what volunteers and visitors have been doing in the facilities. All right, residents that are not fully vaccinated, okay, also known as not up to date. They have to wear a mask outside their room. Okay, they cannot sit at the with other residents. They have to be socially distanced, and they have to stay physically distanced from others in all activities. They cannot consume food and drink outside unless they are socially distanced or physically distanced from other residents and staff. So this is another reason, fully vaccinated, you don't have to go through all of these gyrations. You can have some normalcy. So this is the rule that is posted, and they can so if everybody's vaccinated, all the visitors and the residents, and they're outside or in their room, they can take their mask off. So this is a present that we did win, and that we can get a little bit of room to get back to being more on a normal basis on a daily situation. All right, animals, thank God we can get them back in, okay? You must have some new policies though. So unfortunately, some dogs and cats have had COVID, the early COVID that we were seeing, and we have some other weird viruses that, so you do have to make sure your animals are fully vaccinated and proof of that before they do visit. And if they do, it's one-on-one. If you have an indoor visit animal and you've got a waiver from that from the health department, make sure you're following chapter 7 and that you got all the vaccination records and vet records for your animal and that they're licensed in your municipality. Okay. If you're going to do indoor visits and you're going to be a little more open to that, consider 2 things. One's an ionizer, which picks up the dander from animals, and it also swaps out quite a few different viruses that are like flu-like viruses, not COVID. I haven't seen a new ionizer that can do that yet. But on the other hand, the airline industry, because they weren't as busy, they went and they have built some really cool air ventilation systems for small areas. And I've seen them in grocery stores and pharmacies, doctors' offices, and a couple of assisted livings have got them in now. And so they will take out and they trap the SARS virus and they ventilate the air so that it appropriately is moving and not stagnant. So they're, and in the new builds, they will have to have in their HVAC system, they'll have ionizers and ventilation systems until the next generation of improved products comes out, so that you will not be able to get a new license without meeting that FGI standard. All right, memory care. For those of you that are willing to do memory care, please go to your RCF book and go through page 50 and 51 and be very aware. I would print these babies out. These are your internal policies for section 4. Make sure the staff read them and have a signature sheet that they've read them, so that we are doing our very best to not get the whole house down. So they want small activities still and cohort communities with distancing, and then outside visits as much as possible, and no big family parties, and not, you know, a whole wedding party coming to visit. We had that happen early on in COVID and impact the whole darn community. The other thing that is a present that came back to us in, you know, in the state is that dementia-friendly designations have been reviewed and returned. So many of our communities are not only dementia-friendly cities, but many of our counties are now considered dementia-friendly designations. And so hotels, restaurants, bathrooms have ADA accommodations, that type of thing. That has, you know, that has picked up speed again, and I'm very happy to see that. So you may want to look at memory care. If you are fully vaccinated, you will be able to get your whole residents out to an event and give them some pleasure in life again. And so again, it's on page 50 and 51 for memory care. Now, if you're a small home, and small homes means that you are under 19 by regulation and 7, I'm going to say if you're 10 and under, for the reality of staffing, I want you to pay attention to pages 51 to 53. That's a typo on my part. So ventilation requirements, they want you to ventilate your homes. They want you to have a knowledge area where you're going to put a sick resident or an outbreak status in your home and how you're going to manage that for all the levels of services, including food, laundry, personal care, bathroom, all of that. And remember that they really want your residents to have private bathrooms. And so we have the real challenge of shared bathrooms for no more than 6 people. And probably in the regulation rewrites it's going to come here in the near future, that will even go down further. And I'm guessing you'll be 2 to 3 to maybe 4. So this is a risk management issue. So for those of you that have small homes, go to the RCF and again, copy pages 51 through 53, put it in section 4, think about it, make the adjustments that you can. And if you really get stuck, you may want to call me. You may need to submit a waiver over to the department. All right, staff is on page 55. I've been basically telling everybody stay in contingency or crisis mode unless you're fully staffed and fully trained. And I don't know too many people that are. So you never know when things are going to go upside down and you have an outbreak and then you're back to crisis in a hot minute. So you have to look at this whole concept of unvaccinated staff. So one thing, it's going to cost you money because the department's out looking at all of these reports where people are not vaccinated and looking at the waivers. I'm seeing POCs pretty much on a daily basis coming around that issue. And then second of all, you have to pay 1 hour for every 30 hours worked of sick time with anything that's possibly related to COVID. And so you can't get around this and you cannot not pay. This is for, I don't care how big or how little you are, this is the rule for the whole state. And then, like I said before, watch your liability insurance. They're on our radar. They're looking at what we're doing, and they are and the liability insurance companies and underwriting are really looking hard at whether they're going to still continue to do business in Colorado. So some quick closing thoughts. Like I said, I wanted to get you up a little bit on moving forward on your COVID. I don't want to spend the monthly meetings on COVID. I really want to work on the regular QMP and emergency preparedness planning. So the April 21st at 2, we will have our next section. The one I did in March, Lena has it on YouTube, and you can watch it at anytime you're ready. I've kind of changed how I'm sitting in my office to hope it films better. So we'll see if that works. And then to register, go to our website, go under events, assisted living administrator circle, sign up, and you'll get the Zoom notice. And then if something happens, you can't join with us, please you go watch, and if you need help to call me. So what I'm trying to do is break up the modernized QMP for where we need to go until the rule changes happen again. And what I've done is I've written kind of a foundation QMP to cover the elements that we've been under for some time, and then did a matrix of the most common areas. Some of it is auditing, like medication audits and your fire drills and looking at your equipment. Those are kind of more audit type things, and kitchen water temperature, all that. But then we also need to make sure that we have some project that you're working on for improvement. The one that's really in my mind right now that I'm working on and starting to put energy around is our emergency preparedness plan. So all of the messes that we've had in the last 6 months have really shown us that what we thought we could do is not going to work. So we've had fires in buildings where we had to evacuate the whole building and then replace people because they couldn't return because of the smoke damage. We have had to move people out, like the Superior fires, and some of them got to go to sister facilities, some of them got home with families, some of them had to stay in a hotel, and then you had to take care of them, and then you had to get all their meds and do all that paperwork, and then you had to report to the state, and then you've got to get your building clean and make sure that it is ventilated and ready for reentry. So like the hospital in Avista, that took a frickin' week to do the cleaning, and it was a professional company, had to come in. And then you have to let the state know that you are moving your people back in. They're part of that process. They may or may not survey. I've seen both. And so, it's a much different circle than we've ever had. We had a facility that had to close because they couldn't staff and the administrator quit. And so they literally had to move all their people and temporarily close their building really quick. And that was another situation that is changing the course of how we're going to function as an industry. So like I said, I'm working on this. April 21st is the next section. I'm going to be talking about some general concepts around the emergency preparedness project. And then I'll talk about some of the specifics. In May, I'll clean that up. And then I've got a couple ideas for a couple of summer events. And then we'll see where we are with rule changes and the new legislation that is on the table to what they call a safety legislation, because there is people in the state that don't believe that the 25,000 people that we serve in our industry are safe and that they're going to go and fix it. And so, like I said, very interesting. If you belong to a trade, any of the three trades, we're working together. We actually, Eileen has some incredible movement last week. And Monday is the next hearing. I believe it's at 1:30. And we'll see what happens and whether the bill will make it out of committee and go to the House or the Senate for review, and then the House, or whether it'll get killed and we do a summer study like we've been calling for to try to bring more conversation to the table. So unfortunately, the industry, what I have been advocating for is the industry's been under major pressure for months and months and months, and we're not even getting breathing room to regroup and get our act together. All of a sudden, we're calling that the industry's not safe. And believe it, it was not our industry that had the death rate. It was different industries, but not us. We do still have way too many people unvaccinated, both in residents and staff, and that's got the arrow on us. So that's where we are today. So thanks for listening. Feel free to call or email me, and I'd be glad to help you. Have a great day. And if you get to see this before the weekend, enjoy your weekend.